Menopausal side effects can dramatically reduce quality of life for some women, and many use hormone replacement therapy. However, using HRT increases the risk of being diagnosed with breast cancer. Many women struggle to determine if the benefits of HRT outweigh those risks. Dr. Sherry Arledge is here with Southern Cancer Center with more information. Thank you for joining us here on Fox 10 News.
Thank you so much for having me.
Yeah, so
I appreciate it.
We've been talking about this HRT, hormone replacement therapy. What is it?
So hormone replacement therapy is a medication that women can take to increase their estrogen levels after they've been through natural menopause. Oftentimes women will experience symptoms of menopause beginning even in their 40s, extending up to the age of 60 or later. 80% of women will get symptoms such as hot flashes, mood swings, difficulty sleeping, and hormone replacement therapy is one way to deal with some of those symptoms.
And if a woman does use HRT, are they at an increased risk for having breast cancer?
So there was a very large study called the Women's Health Initiative, which was initially published in 2002. And this was the first study that showed that there was indeed some increased risk of breast cancer for women who took combination hormone replacement therapy, meaning the combination that includes estrogen and progesterone. That study showed that somewhere around 3 cases per 1,000 could be attributed to taking this hormone replacement therapy.
And what tips do you have for women going through that right now, trying to outweigh the risks versus the benefits of HRT?
So the most important thing is you want to talk to your provider. That could be your primary care doctor, it could be your OBGYN, and the most important thing is you want to know what your history is and what your family history is so that you know what your particular risk may be and balance that with the benefits that you can see from hormone replacement therapy.
Is there a safe way to take HRT while also monitoring your risk for cancer too?
There is. So typically, once you have a consultation with your provider, if you decide that your symptoms, such as the hot flashes, the insomnia, are significant enough that you warrant taking the hormone replacement therapy, then you want to take it for the shortest length of time possible to try to help with your symptoms. You want to use the lowest dose that you can that gives you the benefit, and you want to periodically reassess with your doctor. Is this still the right thing for me to do? Have I had any changes in my health? Have I heard of anyone in my family that has breast cancer or other risks that might mean let's take it down a notch or let's go ahead and stop that therapy now?
For women with questions on where to start, where do they start and what doctors should they speak to first?
So primary care is always a great place to start. For young women, a lot of us don't have primary care doctors. Maybe we rely on our OBGYNs. They are very well versed in this. For people who have a personal history of breast cancer or a strong family history of breast cancer, they may want to talk to their oncologist. And we do have nurse practitioners and physicians that can meet with patients and talk about that risk as well.
For more information on you and Southern Cancer Center, where can they go online?
They could certainly visit our social media or our website and get information about any of this.
All right, Dr. Arledge, thank you so much. And we'll have more information on fox10tv.com.